Thanks, guys, for hanging in, staying in to the end. Bit of a ghost room, but it's all good. There's recordings. You can hear? Okay, my voice goes really quiet, so just give us a signal if you're not hearing much. Is that better? Okay, cool. Okay, Fangji Dihuang Tang. Anyone here? Firstly, do you guys use herbs? Yep, cool. Okay. I just noticed that there was only 2 herbal presentations this year for AACMAC, which is less than last year, let's just say that. Fangji Dihuang Tang is an interesting formula. Why do I talk about the classics? One, I talk about the classics because I believe ultimately they hold the clinical history. They've got the ultimate results-based medicines, if we'd like to talk about evidence. Results-based medicines, they've been around for thousands of years. They've stood the test of time. And in understanding the traditions and going back to studying the classics, it helps us be able to treat and deal with current health situations. Every great teacher, Michael Brown gave a great talk yesterday about the history of the Chinese medicine, the Wenbing. Every great teacher, Sun Tzu Miao, Li Dongyuan, you name the teachers, Li Shizhen, all the famous people that you name drop. They all went back and studied the classics. There's a reason for that, okay? They ought to grasp and really understand, and I believe personally, to practice this medicine at the highest level, you've really got to grasp and understand the medicine from its roots. I think today, sometimes we could fall into a little bit of a pattern where society thinks, oh, this old stuff, it doesn't really happen anymore. It's fallen out of fashion. It's not really relevant for today's situation and today's cases. I hope to sway otherwise. And to be honest, look, I think that's both 2 things. I think it's naive, and secondly, it's arrogant. Like you seriously think you know better than this thousands of years of tradition. I don't know. I question that. Look, the reality is that we still don't know how they made many things. People don't know yet still how they made concrete, Roman concrete. They still can't reproduce Roman concrete. Still people are debating on the pyramids. There's these floating gardens in the Aztecs used to use called chimpanas or chinapas. These floating garden beds, which produces the most fertile growing stock. We still don't know how they did that. There's a body of evidence and a clinical understanding, which is relevant for us, which I think the classics hold, which is why I'm a bit of a geek on it. So anyway, I hope you enjoy it. As with all things, I like to recall, and I recognise my herbal teachers, my training. This is where this comes from, to Arno Veslus. Well, it goes left to right, Dr. Tien, Zong, Veslus, and Laurie. These are people who have influenced me greatly. What's the current present health situation? It ain't good. In a nutshell, mental health is not something that I think we're very strong at. I don't think it's something that's very well treated. Why? Just more and more cases of it. And I don't believe that's just people that can diagnose better, that we've got better diagnostic systems. In Australia, I'm trying to turn around so I can actually read my own slide. Basically, 1 in 2 people struggle with a mental health situation through their lifetime in Australia. Anxiety affects 1 in 4 people. And it's, and it's very well treatable. Depression affects 1 in 7 people. Okay. As we were chatting out just before we came in, I said depression is really interesting. It's a very real system, but the theory, the practical Western medicine theory of depression, a serotonin deficiency, is actually incorrect. But guess what? It's the standard of treatment. We've got a system of treatment whose methodology in theory is flawed, but that's how they treat the problem. I find that just gobsmacking. 1 in 6 Australians will have suicidal thoughts during some point in their life. Support is available. And so, I put some sources on there, some with this information. And where did I get this from? A lot of it's from the Beyond Blue, which have a fantastic resource guide. And it's available for people. You can direct your patients to it and make use of it for yourself how you wish. Counsels available. The big thing that I found was really interesting is that, because this leans into a little bit the Fangji Dihuang Tang talk, is that 1 in 200 Australians will experience a psychotic illness a year. I mean, I don't know about you, but to me, why are we not seeing this formula being used more often? And for me, I know it's readily, I use this formula quite a bit. It's quite an obscure formula. We don't hear about it a lot, but I see it. I see it all the time. And what are the mental causes? From beyond blue, they come from this alcohol and drugs. I think we've become very familiar and comfortable with drugs, and with familiarity also don't treat it with the respect or the caution that we should. Everything from everyone's tripping on psychedelics and we're, low dosing this, taking this type of drugs. It's not that bad these days. Yeah, I don't know, it's questionable, but, it's much more used and misused. Social media, I mean, where do you go with that? Media in general. I mean, as I like to say it, when you see the media that is so dissociated from reality, no one talks like this at the 6 o'clock news. Yet the media is so provocative with its language. It's so stirring to people's psychology. I think it's nuts. Of course, we have now cyberbullying, workplace stress, health stress, financial situation. We've got the crisis, the financial crisis. We've got the unprecedented this. I think the media really needs to look up the word unprecedented. It's not a daily thing, people. It cannot be if it's unprecedented. And not everything's a crisis. Some things are serious, I get it. But really, a crisis? But they know the words that trigger us. They know the response they're looking for. They need to get us to pay attention. We've got a 24-hour media cycle streaming this SH1T garbage into our system all the time. I think it's just nuts. For those who are older like myself or those who are not from Australia, you may want to ask an Australian, someone older, ask someone younger may not know the reference I'm about to give, ask someone older. But there was a famous band, the Skyhooks, and they talked about our news was, when we were younger, I was younger, was commissioned to 1 hour, once a day. And their famous song, Horror Movie is the 6:30 news, and the song finishes, and it's shocking me right out of my brain. I think there's a lot of propheticness in that song anyway. This is just something I throw in after, not to stir up conspiracies, but God damn, you've got to love a good conspiracy. But the interesting one, I think is more interesting, is just a few days ago. I mean, the most thing to draw your attention to is the fact that the COVID and also the stress that was put through people's response. I think we give it ad lib service. Yeah, it was difficult. Yeah, we're all under a bit of stress, but let's not talk about it. Let's not think about it anymore. I think we've just seen the reasons for it. I mean, 2 years ago, I gave a talk on Bai He, the lily bulb patterns. This is a little bit of extension on that, and I think it's a progression of it. But back then, it's like I started seeing these formulas turning up all the time in clinic, and then it's like, this is really interesting. But then when you look at this, intense social restriction, fear, 24-hour cycle of driving fear home, and then getting a virus that generates fever, heats up the pericardium, the nutritive, or heats up the blood, creates all these other problems. And then people start having accelerated brain aging, both prior as well as a result of catching the virus. We have triggers for what stirs the heart. It doesn't always have to be emotional. It can be anything that increases your heart rate, so a fever that does that, excitable. But fever response generates a heart response, heart rate increases. I just saw Jason Robertson's talk on Dry In. If you haven't looked at the one, have a look at it. It's a perfect preamble into this. Is there a place for us at the table? Now, in all reality, I'm not in any delusional state that somehow Chinese medicine is going to be recognised by Western medicine or that we're going to be treating stuff. But what I really want to do is poke the bear back. Antipsychotics is the most, if you want to take evidence-based medicine, man, that stuff is the most poorly treated. Anyway, let's not go there. Basically, have a look at this. It's quite interesting. All I really want to point out to is the fact that it's not as good as I'd like to think it is. In a nutshell, and this is the own research. The effect is moderate. There is significant placebo effect, and individual responses vary. It's not as rock solid as they'd like you to think it is. The findings contradict a widely held conception that all antipsychotics are equally effective in the relapse prevention. Differences in their side effects are marked. Not to say that some people require this. No doubt at all. And I think the only reason we're not seeing much more of this is because of medical suppression and institutions. For Brisbane, we just saw that Ramsay closed down 17 of the 20 mental health institutions. They're great. Where do these people go for help? We're going to see more of it in a nutshell. So let's geek out on the herbs for those who like herbs. The formula comes from the Jingui, chapter 5 and line 3. So this is why it's an unusual formula. It reads as, it treats diseases that manifest like mania with reckless behaviour, incessant soliloquy, talking to oneself, absence of cold and heat, and a floating pulse. When I first learned this formula, it was treated or discussed as like, this is where for crazy people. Like, anyone from Brisbane, if you've been into Brisbane, or everyone's got a city, right? And everyone's got a major city where the partying is happening. You will see Fangji Dihuang Tang on a Saturday morning after a big night. These are the crazy people walking the street and they're talking, they're doing this stuff. That's how it was always taught. This expression, I think we're seeing a lot more of this, but you don't see that. That is a spectrum. We don't see that full expression as in these people having real psychotic or mental health issues. But this is how it was always taught about. So we're not really going to see it in clinic. Who sees those type of people? Man, I'm seeing this stuff all the time. And I'm not saying that to make a good point, even though it's nice. But it's like, no, this is clinical. It's real. I see this stuff. Last week, I prescribed the formula 3 times. Like, it's just, yes, do we attract our own patients? Most likely, and that's self-reflective. I get that. But no, this is, I think, I hope you'll be able to tease out some ideas on how you see this, how to question this, to see that this is actually a lot more in practice. The preparation is interesting. Okay, you can read about that, but basically, anytime Shendi is used in the Jingui or the Shanghan, it's always with alcohol, except by one, and then they use it as a juice. So the blood delivery is using alcohol as a methodology to get into the blood layer, to strengthen this is a particular interest. This is even more fussy in that you've got the 4 herbs, the 5 herbs which you soak in alcohol and steam, and then you add the juice. So good luck finding the juice. You can just use standard Shendi. The way the chapters of the Jingui writes, so the Shanghan Zhanbinglong is a book designed or split into 2. You've got the Shanghan and the Jingui. The Shanghan deals with external strikes, the 6 qi, climactic influences, which is not cold, as in I'm catching a cold, it only deals with cold. Hopefully we can, enough time that's been said that you realise it's not just cold, but it's cold as a broader category. And then there's the internal patterns. Internal patterns are emotions, and then there's non-internal, which is lifestyle, dietary, trauma. It's what they call complex. Another word for saying messy. Not so straightforward. Okay. The way the chapters are written is it's like a dialogue. Here's Zhang Zhongjing talking to students, and you were talking about a different topic, and now we're talking about wind strike, and then he goes through all these different chapters of wind strike hitting the collaterals, then wind strike hits the channels, then wind strike hits the hollow organs, and then wind strike hits the solid organs, and these are the formulas and how it manifests. Cool. And then he goes, there's this other thing called that also is wind strike. Fangji Dihuang Tang. It's a sort of, and you can also sometimes use Fangji Dihuang Tang for wind strike, but it's a different pattern. So just, again, touching on lightly, wind strike in the Shanghan is Zongfeng. Okay, that is wind strike. It's when wind strikes from the back, affecting the Taiyang. So chills, fevers, sore throats. It's the standard cold presentation, catching a cold, but not cold, as in I'm feeling cold. Okay. Chapter 58, Nanjing goes into the 5 types of cold, 5 types of cold as in a broader category. Jingui deals with complex disorders, wind strike when it occurs from the front, so deficiencies, complex patterns are developed. You run the person down over time, and then they just need some knock, some trigger to develop that pathology. Okay, wind can be a broader category here for something that's sudden, severe, as well as wind as a climactic issue. The formula structure is interesting. How do you memorize a formula? Why? Because you should memorize your formulas. It's important. You've got to know your medicine. Part of knowing medicine is know your herbs. Formula's easy. It's 2, 2, and 1. Grade your gun style. Fangji Dihuang Tang, and they're two pairs of herbs. They are pungent and sweet moderate herb, pungent and sweet herbs. Guizhi Fangji, Guizhi Gansao, pungent and sweet. Feng and Fangji, pungent and sweet again. And there's a reason for that, I'll explain in a second. And then the last one is a big whacking dose of Shendi, 48 grams. 5 herbs, 2, 2 and 1. You'll never forget it. The important part here is to remember is that when I'm talking flavours here, I'm also referencing the Shenlong Benzao Jing. Why do I reference that book? Because the book was written 1800 years ago. They didn't have the modern TCM text. And we go, oh yes, no, this is the flavour. You can have one herb does 5 different flavours, it enters all these different meridians. No. You use the text that to understand the medicine of the time, use the text of the time. So I'll be referencing from the time. And then when you can do that, sure, you can argue amongst yourself after about that. But it's like, this is why I reference this, because you want to understand how they were thinking, understand the referencing of the time, and that was what they were using. So Guizhi is a pungent, warm herb. Gansao is sweet. Sweet and cool, sweet and balanced, actually. Look, Guizhi Gansao is the basic and functional unit for strengthening heart yang. Guizhi Gansao Tang. 2 herbs. It's a standard herb straight out of the Shanghan for heart yang weakness, heart yang deficiency. The next 2 herbs, Feng and Fangji. These here, again, the same principle, pungent and sweet. But here we're using to build yang, to deobstruct the stasis, disperse wind, open the orifice, because the brain and the mind is an orifice, and penetrate the channels. So I said to before, we were going from wind striking the collaterals, channels hollow, and then the solid. So there's this progression of damage done to yang and to the blood, because the blood's through the periphery, through the circulation. It's where we build damage through the collaterals first, and then it moves inwards. So they have to break up that congestion. To treat it, you have to deconstruct to allow the penetration of the medicinals into the target organ or meridian, whatever you want to call it. So Fangji Dihuang Tang treats blood and yang deficiency, nutritive and specific. It's the floating pulse is because the pulse, that's basically a blood deficient pulse or yang deficient pulse. Wind also lifts pulse. Cold creates a lift as well to the pulse. Lots of reasons that can show a floating pulse. Wind has an ability to strike the interior. Why? Because the channels and collaterals are congested. Once there's a deficiency of yang, once there's a deficiency of nutritive and nutrition, disease can progress inward to the interior. And the main herb for protecting the pericardium, Shendi. Again, Jason did a great talk on Zhuayin. I mean, the representative herb for Zhuayin tonification is Shendi. It's nutritive. It's the nutritive that we're treating. We're treating the nutritive in the upper heater, the source. You've got to remember the lungs are a canopy, so that's Taiyin. Lung Taiyin forms the canopy by fluids that are collected. The heart is there. The imperial fire is the emperor that sits there, does his thing, look glorious, is surrounded by the pericardium. It's a fluid-filled sac that heats up and moderates this expression of that imperial fire to the exterior. You are then, but we also know that Shendi is what? For all our TCM days. Shendi is a kidney herb. But how does kidney herb support this? Well, water generates wood. It is using the kidney water to generate nutritive, Zhuayin nutritive. The formula just works pretty nice from that perspective. Also, another thing to keep in mind is, and this is just my own reflection, look, I believe that Fangji Dihuang Tang is the spectrum of the Baihe patterns. It's just the full expression. So we see a Baihe. So Baihe pattern, the standard representative formula for Baihe being, or lily bulb, is Baihe Dihuang Tang, which is just Baihe, lily bulb, and Shendi. So you've got nice and clean cut Zhuayin and Taiyin nutritive. The full expression, when we see the extreme of it, we come to our Fangji Dihuang Tang. That's in our deficient cases. I'll show you some things interesting about excess in a moment. So that's basically the formula, the idea. Just a bit, wrap your head around the things. So what we're actually looking at overall is this concept of fire, and then we'll come back to qi and blood all the time. So there is a material component where we talk about treatment, and then there is the functional component. And the functional component, or the functional aspect, is what is the functional aspect of yang. So yang is the warmth that emanates from the blood. That is what actual yang is. It's an immaterial, it's something that you can't see and touch. If you can touch yang, that ain't it. It's an immaterial substance, but it's the warmth that emanates out of blood. And so we use this reference that blood is liquid yang. Pure water, what is yin? Yin is pure water. But how is yin taken into the system? It has to be put into a gaseous state. And qi is gaseous yin. So when you see this, you'll see this interplay between the formulas and the treatment. And again, going through these concepts, you've got blood, qi, as in yang, external, yin, collateral is the internal, as in representing to yin, yang, yang of each. Then you've got hollow organs, solid organs. You've got a yin-yang interior again. And then just these other concepts just to keep in mind for what we talk about fire. Sometimes when they, and I noticed that Jason said this quite a bit about, liver, and we're talking about liver and wind and so forth. You've got to remember, liver is a capital L. It's the broader category of wood element. It's not just liver as in, I'm talking about the liver. And that's, I think, most of the time, it can be very confusing and you can feel a little bit limited or trapped as to where you can see use for these formulas. When you see, we've got to say, I'll be talking about fire, which is fire is a larger, broader category of element. So it's fire, heart, pericardium, small time. It can be stanjiao, it can be a whole broader category. But on the Neijing, so you've got chapter 79. I'm not that clever, I just write them out so you know. So the 19 lines points to all muddledness, all convulsions, everything belongs to fire. It can be fire heart, fire pericardium. All unrest, the mania and excessive behaviour belongs to fire. All rebellion, which is this anxiety, this upward rushing, insomnia, restlessness, again belongs to fire. And all sudden diseases, rigidity belongs to wind. So there's a context where this comes from. So tie in, so I'll be swapping between nutritive a lot. So nutritive is basically simply nutritive. It expresses itself or is seen differently depending if it's lung nutritive, or is this Juayin nutritive. Okay, the tissue is tissue specific in its action. All right. So then the pericardium, the lungs become the upper source of fluids for the body. The heart, as I mentioned a little bit before, is the impurified, doesn't move, it sits there. It's wrapped by this pericardium. That so provides a nice thick buffer and barrier to the exterior. The impurifier is what then heats. So the heat that's generated by the emperor heats up the pericardium. This fluid, the nutritive in the pericardium, can create warmth. When you heat a fluid, it'll eventually turn into a gas. Okay? The vapor that emanates out from the heart through the pericardium, that's qi. And that qi is ministerial fire. Okay? Jue Yin, I think Su in 68, Michael will check me on this one, I think, but Jue Yin in the Ben Biao Zongqi, it doesn't manifest from its ben or its root or its branch, it manifests from its Zongqi. And all Jue Yin patterns manifest from its Zongqi, which is ministerial fire. Hence we see this fire, a lot of excessiveness, it's actually talking about pericardium. All right? It's just a broader category. Classically Chinese spoke very vaguely because you capture the element, then you can zoom in on it. But if you zoom in on it too quickly, you're going to miss the greater element, the greater picture that you're trying to convey as what's going on. Also gives you wiggle room, you can talk yourself out of any argument or talk yourself into anything too. What do we got here? So this fluid-filled sac is the pericardium. The thing I like to remind people is that this barrier is a buffer between the interior and exterior. So the heart is our motivation, our drive, our calling, our mission, our purpose, however we want to look at it. It's its expression outward into the world. It's buffered that through the pericardium. The pericardium steams and creates qi to do action, to express yourself through the world. That is done through the pericardium. Okay? Your ability to express, communicate, put out your desires, and interests and so forth is all done through that. And likewise, it's a two-way buffer. So the exterior world coming in onto the interior is back through the pericardium. If the pericardium is depleted, heated, dried out, this little canvas is like a lampshade, becomes a little bit holes, light starts to pierce out, and we start to see through to the emperor. And emperor was always considered God, within that symbology. Okay, everywhere I can only tell you, whenever the gods in history come down to earth, whatever your concept of that is, it's always been bad. Whether it's Mount Olympus, when the gods come down to Athens, problems happen. We are not meant to see into the heavenly realm. Unless there's always a structure and process by which people go through things to actually train towards this, but we don't want to do that. We just want to pop a pill and trip out and have a wonderful experience, which is great, good for you. Interesting though. Look at, again, this has been stuff that's done for 1,000 years. Why? Because it cannot be that clever. If it's used and it's been done before, guarantee they've done it before and they've developed a system or a codex by which they applied it. And you look at all the psychedelics, how were they used? Whether people used sweat lodges, so what did they do? They forced themselves into a Dihuang pattern. How do they do that? They fast. Then they go into a sweat lodge. I was in Canada last year when we went to one of the Native American lodges there, and there was a sweat lodge. I said, I'm curious, how do they do things? He goes, oh, yeah. And so how long do you go in for? Oh, you go in till you have a vision. I said, what do you mean? He goes, oh, you could be there. So why are you fasting before it? Oh, otherwise it'll take too long before you start having hallucinations. I said, oh, that's interesting. Dry out the stomach, producing the nutritive, which generates and steams up into the upper heater, produces the blood, hence that tie-in, comes from the stomach, spleen. See, it's still lung and spleen. The stomach is what creates it, gets up into the upper heater, then it thickens and creates that cooling source. You don't want to stir up the heart too much. You don't want to dry out the pericardium too much. Why? Because you're going to trip. I better not swear. You're going to trip out on this stuff. And so they would stay in and have a sweat lodge until they had hallucinations. And as soon as they had hallucination, I'm out. They could go out and say, yes, this is what it is. Go off. Here's your life journey. Go for it. The peyote. What do they do with peyote? They've got a long history of taking it, not some party drug. So what do? They purge. They have a very specific diet. And then what do after that? They take a drink. It gets them to vomit, gets diarrhea. So you dry out all the nutritive. And then then you take the cactus. Not all trips are nice trips. And then they have euphoria. And what is euphoria? The heart, the pericardium stirred and fanned to a point that they're spitting out, Again, they've developed this system. This stuff has had to have been there before. Just work out why they did that way and then use it in a proper clinical setting or a methodical way. Otherwise, people have massive issues on drugs and tripping out. Lastly, Nanjing, we talked a little bit about the 54. Suwen, all diseases belong to cold category. Cold is a capital C, not just cold as in catching the cold. Cold is a broader category. God, I wish people would stop saying Shanghan only treats cold. That's when the book comes really helpful because you can then use the book to throw at someone because that's stupid. Anyway, emotions of the heart are joy and pericardium. Are joy and sadness. That is what the heart experiences. Anything outside of that, that's the pericardium. Expressions beyond just half the that's heart. That's the heart. That's the heart. Being happy. If it gets excessive, that's the Joker, crazy. That's mania. So the emotions are this festering of the ministerial fire from this overthinking, insufficient sleep, vexation they like to use a lot. When you see vexation, they're talking about the pericardium drying out, heating up, restlessness. And basically, where Fangji Dihuang Tang is the deficiency, for those who love like herbs, I've seen now that there's a deficiency. There has to be a yin, there has to be a yang. So what's the excess cases? Chahu Jalungamuli Tang or Chahu Gweji Ganjang Tang. Okay, they're your excess patterns. Fangji Dihuang Tang is your deficiency. And for the real herb geeks, why is that so interesting for Fangji Dihuang Tang? Because it contains two herbs, muli and tianhua fen. And in the bioherbing, one of the 7 herbs for bioherb is guala muli san. So, and Chai Gweji Ganjang Tang is more for chronic Shaoyang patterns, repeated cold and flus, stirring, generating fever, drying out the tissues, the pericardium in particular. So it's already as a built-in safety mechanism towards where is this pattern going. You do this chronic, not frequent enough, you will develop bioherb patterns. And why? The formula has the safeguard already in it. I thought it was cool anyway. Fukushin. Anyone do abdominal diagnosis? Cool. Abdominal diagnosis. The Shendi pattern is very, 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 very clear to see. Okay. It's the Shendi method is the standard representative formula for Shendi method in the Fukushin Japanese abdominal diagnosis is Shengqi 1. Why? Because its key herb is Romania, is Shendi. Now, if going through, basically, again, you see this dryness pattern, this subluxation, where you get this softness through the abdomen under the belly button. But Rikyu is this tight parallel bands that can form. But it's not just Rikyu, it's a sort of a subsection of Rikyu. When it goes below the abdomen, you get this tension. Does this have a button? A laser, ooh. Weird, a laser doesn't work, excellent. And so the abdomen here, you have this tension underneath here. You have this pulling, 10 minutes, oh shit. Okay, thank you. This tension through here, this pulls through here, and you get this very softness that happens, and this tension, this pulling looks like a bow tie. Have a read about it. Nigel Dawes talks about it a lot more. It's really cool. Then you got why. I also put the Granger-Gunsar method because why? It forms part of the formula. And Granger has this for this pulsation, upsurge, heart-young deficiency. Look, it's more just more for your reference to be interested in. The other thing I find that's really interesting, though, for those who do checks, REN 17 from Mu point, pericardium, blood C, and Chi point. Chi is an influential point. What is it? The Chi? Influential point of Chi? I haven't done acupuncture a bit for it. Influential point of Chi. Why? Because the pericardium, it's telling you that's where Chi emanates from. Because of that link through 33. It's steamed out from the heart. But you can palpate through here. It's quite often very tender for people with this pattern, and all redness and that type of stuff. Historical commentaries. Michael's the man to go through. He gave me these, so thank you, Michael. Make me sound and look more intelligent. Have a read of those. I've only got 10 minutes, so I'm going to try and get through it all. Evidence-based medicine, for those who are really into evidence-based medicine, I'll flick you a dime. Not that interested in it, to be honest, but, there is, I like to be flippant, but it's not because of anything. I really feel there's a lot of stuff that shows where this can be used, and there's a history of use. The most important thing is, like I want to talk about in the few minutes that are left, I've got 4 cases. I was saying to some friends before, I said I would have said now a good solid 20 plus Fangji Dihuang cases in the last year. And I can very much pick these now. So this is my oldest patient. She's 97, and I've treated her for decades. I've been in practice 33 years. I've been treating her for literally decades. She's absolutely lovely. She has long-term, basically history, long-term tachycardia. She's had AFib and issues in the past, but she gets these recurrent UTIs, all right? And sometimes she doesn't have a UTI symptomology, no burning or stinging. But what she does have, and we know now that that's the pattern for her, and it's actually recognised in Western medicine, she has hallucinations. She sees people, talks to things. And as soon as they now know when she's having that, why is that? Why is a bladder infection creating hallucination? Because Tai Yang is a lot of qi, a lot of blood. Is a lot of blood. When you heat the blood and the pericardium is deficient or thin, or blood is deficient or yang is deficient, you are going to cause hallucinations. You're going to break through that little shielding of that from the emperor, the veiling, and you'll see in through to the heart, into the heavenly realm. You'll see stuff you're not meant to. Okay? So she had basically this. I used the combination of Granger-Dihuang Tang, mainly just to support and regulate heart yang, to stop her tachycardia. And we added Fangji Dihuang Tang with some Baihe and Huashi to cool, nutritive, and also help with the bladder infection. Her daughter rang a couple of days after I used it. This is the first time I used it her. And she says, oh, it's fantastic. She's not hallucinating. She's sleeping better. I just went, oh, this is cool. We all want those cool stories. And of course, I'm only going to tell you my cool stories. After that, the standard pattern was interesting. So now she has on standby a Fangji Dihuang Tang with Baihe Huashi whenever she sees hallucinations, and I go straight away to give her that formula. I use abbreviations. If you just want, just look up the herbs. The formula's there. Second case is a 40-year-old girl here. Long history, 12-year history of anxiety, depression. In a long nutshell, I had her on basically a Granger-Dihuang Tang plus a Baihe formula with some blood stasis underneath, with a Granger fulling one and some insects. She had that before, and she was doing okay, but really not so impressive. Then she started to talk to me about this. So how does this express itself clinically? Anxiety, depression, fixation, OCDs, looping thoughts, internal chatter. Does this sound like anyone? Like like all of us. But when it gets, why are we don't talk about the stuff in our head? The Fangji Dihuang pattern patients, they do. They will externalize it. They often talk to themselves. They have this real internal mental chatter. The looping thoughts, it's really common. Addictions, this is it. I put her on that formula. She had her instantly within 1 week, massive reduction in the looping thoughts. The urine started to cool down and so forth, which was nice. Then as she started to improve out of that, I went back to that formula that she was originally on. And that was it. You can read about it. But what's more interesting is how do you tease this information out? So there were 2 deficient cases, and then I got 2 excess cases. This is a young guy, 15 years old, little kid, classic child, or teenager, grumbly, internal, moody, insecure, insensitive, nervous about school, all of us, what we went through. This kid would murmur a lot to himself, which I thought, I asked him, did you say something? Oh, no, it's nothing. He'd be like this, lot. Dude, that's kind of weird. It's like, oh, okay. He had a great pulse. He felt the pulse fitted, and he had a real internal issue with his parents. Like his mother was the main carer, his father was in the army, would go away a lot, and there was really tension between him and his mum. Whether he had that role model there, who knows what. You can wax poetic on about it later. But the interesting thing is that he was a Choya Jalunga Muli tongue pattern, okay, which I used, and I did. He had some congestion, because he actually came in for sinus problems, repeated long-term history of sinus. So I threw a bit of lingua jugantang, helped dry up the phlegm and sand. But what really interested me is that this kid's he's really going to, if he ever gets pushed, he could get really aggressive and nasty. He would have sometime, like once in a while I said, hey, that's not cool to treat your mum like that. Like he would get really narky and lash out at his mum in the clinic, in the session. I just said, hey mate, you don't talk like that, Put him on the formula. Basically over a couple of weeks, he eventually came in where he stopped his murmuring, his mumbling. He would talk to me, he would engage with me, and then we just went on and treated the rest of his sinus. The last case, and I slip in just on time. This guy's really interesting. It was an excess case. So it was a Choya Jalunga Muli tongue, which has Dahuang in it. I did not keep the Dahuang in it. It wasn't excess. I used the Jushu Gweja tongue to open the hollow spaces to keep the descent occurring so things don't congest and heat up. But he was a Fangji Dihuang Tang case. Why did he come in? He's had that bad anxiety. I know this guy's had, he's experimented with social drugs and he had a bad trip on one of his mushrooms. I was like, oh, okay, that's interesting. But he would talk about like his mind was racing, he's fidgeting, I just can't calm. He talks to himself and he goes, oh man, it drives me insane. And one thing that relaxes me is like I swear at people all the time and I feel so much better when I swear. I went, okay, that's cool. Anyway, a lot of stuff going on. But what really triggered me onto this, which made me realise what it was, he goes, man, it's like I got to go out to the country to relax. It's the only way I can relax and calm down. But it's like when I'm in the city, I can hear the city breathing. I can feel it. I go, man, you're weird. I didn't say that. It's my head going, okay, that's weird. Who hears the city breathing? I mean, that is an hallucination. That is someone making shit up and saying, yes, that's real. So the first thing I do with a lot of the cases with the Fangji Dihuang cases, and this is what I think we all should do, is first tell them your thoughts aren't real. Stop thinking that your thinking is real. It's just crazy stuff. Let's try and create this harmony, this balance. I put him on that formula. He rang me again. What I found with this formula, when it works quickly. You don't have to, let's wait a week and wait a month and see how things go. No, it works. When it works and hits bang on, this is like within a day or two, people notice a difference. And so, anyway, he had a great response. And then when he came back, then we started talking. I mean, I'm making jokes, trying to make it light because you guys are actually here. It's the last day and the last minute. Let's make it fun. And I just said to him, I was just like, now I could talk to him. Then I said to him, mate, you're in a really unhappy marriage. You're arguing all the time. Have you sought counselling? Have you tried to do this? Because, no, I think that's where I need to go to next. It's very difficult to bridge a lot of this stuff with people without making them seem weird. Oh, yes, do you see people? Do you talk to dead people or see things that's not there? Oh, yeah, I'm totally comfortable to tell you that. But you've got to be able to tease this information out of people. people, you need to create a safe space so people can talk to you comfortably, to be able to open up, and then you can ask them, do you have a lot of thoughts? Is it really busy? Do you find it really calm, difficult to quiet that thinking? He goes, yeah. Do you find something you've got to, just externalize that thinking? Because, it's really driving you crazy? Like, talk to yourself. Oh, yeah, I do that lots. Don't just say, do you talk to yourself? What do you mean I'm crazy? Which is how I found out it's not the way to ask the question. And there's two cases, I've then we'll finish off, but there's one guy, he's a classic Aussie builder. He works, salt of the earth, works his guts out 6 days a week, 12 hours a day, some days 7 days a week. When he was potentially going to bankruptcy, the type of gentleman he is, he rather than going to bankruptcy and leave everyone else hanging, which he could have and just saved himself 10 years of torture, he basically wanted to see his loans out. So he works like a madman, drinks like a madman to relax. And of course, I said to him, I was talking about this because he had this pulse, and I thought, man, I'm trying to work out how to ask these questions. And I asked him, do you sometimes find you got to say your thoughts, or you hear things, or talk, or say stuff? But you think I'm crazy? You go, no, sometimes your mental chatter is so busy. Sometimes you feel like you hear stuff. I'll talk to myself or hear stuff. I go, yeah. He goes, oh yeah, all the time, mate. I go, really? He goes, oh yeah, we got it in the office now. The girls in the office, I often say to him, did you just talk to me? Did you just say something? And he goes, and so that's how he knows, because it happens so frequently that he's got to have a filter for it. I had another guy who they called it the cat. He would see this cat that comes across. Oh, there's the cat again. Whenever he was more into deficiency taxation, which is what ends up happening in your Fangji Dihuang Tang cases, these are deficiency taxation. Blood is deficient, young is deficient. When he was pushed out, and he was a band player, and when he was a bit too much partying, long hours, they called it the cat. I mean, people have much more, you realise, these type of things. It's not more, extreme stuff, but it is there. And the last one is a patient. It was just only 2 weeks ago. She came in. I only thought about this, which was, I thought, not that I'm clever, I thought it was really interesting. I saw her over a year ago for a brain tumour, glioblastoma she presented with. I was originally seeing her, and I'm comfortable when I know what I can do. And when I see and I give a prescription, I know what I should expect. And it wasn't really happening. She was getting this dizziness, this disorientation. She was finding it difficult to organise herself. And so I said to her, after 3 days, still happy, I said, this is not right. You need to go to a doctor. I know what this should do, and this is not doing what it does. She was diagnosed with this glioblastoma. Terrible, and that was it. The world turned upside down for her. I had her on actually triajalungamulitang. I often wish I knew. I always knew. We learn from our patients to be better for our future patients. Okay, and I thought of this. I thought, wow, I really wish I had known that. But that's over a year ago. She was given less than 6 months to live. She's here as a great disappointment to all those predictions, which is wonderful, and she's doing quite amazing. She's in fact she's in a not this is me, this is not me, but this is as a person what she's done. She's they don't know what to do because they never see someone live a year. She's in this pattern. They're going, we're now seeing the side effects of the surgeries and everything we did at the beginning. Why? Because normally people don't complain. It's hard to complain when you're dead. They don't see this symptomology till later. She's living longer. Now they're seeing the problems of having these treatments. And I just gave her, she came in and she's incredibly muddled. They were getting ready to go away for a holiday. She was finding it very difficult just to organise. She would break down in tears, couldn't organise. And she's got the classic pulse. She's got the classic Shendi abdomen. It's like this papery thin skin, almost like a stocking over her fascia. And then it just sinks in. And I just went, why didn't I do this before? So I gave her Fangji Dihuang Tang. Again, she rang the next day. She was crying. She goes, I just feel calmer. It's just clearer. It's just my mental chatter is gone. There's a lot more place for this. Thanks for your time. We're winding up quick. Any questions?
One more question from online. Excellent presentation. Are you using raw herbs or granules?
I now just do granules. I practice from home now, so a raw herb dispensary is just too damn big and too hard to maintain. I just use granules now.
Any question in the room? Okay. Yeah.
Nope. Grapey one. Oh, I knew somebody. Oh no, maybe one. Don't say Great Dihuang because
Just want you to differentiate between when you use the Fangji Dihuang and the Great Muli tongue. One's for more excess, one's for more deficiency. Is there any other particular thing that will stand out for you that'll have you choose one over the other that, something's quite obvious?
Good question. Two things. Pulse. If a Chai Muli tongue pulse is not a Great Muli tongue pulse. They're very different pulses. They feel very different, and see you Ian. Safe travels back. It's a very different pulse, first up. The excess manic type, these are a little bit more restless, a little more agitated, they're a little more demonstrative. Like that guy, the previous one, this guy, he likes to swear, that's the way he calmed down. Like he was a little bit more out there, more expressive in his stuff. Okay. Excess type. And I'll use, I see this as two types. Actually, it's a little bit more complex, but it's actually a triad type thing. But there is the excess patterns of more your Chai Hu Jalongamuli, Paplurim and Dragonbone, or Chai Greja Ganjang. Otherwise, the deficient type is the full spectrum of the deficiency is your Fangji Dihuang Tang. It starts at your Bai He Pings, at your Bai He patterns. And that expression across is into the Fangji Dihuang. And Greja Gansao Longamuli is that heart yannick sitting up. So Greja Gansao Longamuli tongue is Greja Gansao Longamuli. And what's the functional unit of Fangji Dihuang tongue? Greja Gansao. Okay, you have to anchor the yang into the heart. You've got to give a material substance to anchor the yang into. When it's functional, Greja Gansao is enough. Chayu Jagu is enough. It's just functionally working on the mechanism. When there's material deficiencies, that's when you're moving in with Shengdi. By her. You need more material substance. Sometimes you need the two.